A stroke is a sudden and potentially life-threatening medical event that occurs when there is a disruption in the blood supply to the brain. While most people are familiar with the classic signs of a stroke, such as sudden numbness, confusion, and difficulty speaking or moving, it is important to know that there can be warning signs that appear as early as 1 month before a stroke occurs. Recognizing these warning signs can be crucial in seeking early medical intervention and potentially preventing a stroke. In this video, we will discuss 11 warning signs of a stroke that may appear 1 month before the event. Number 1. Sudden and severe headaches. Sudden and severe headaches, often described as thunderclap headaches, are a cause for immediate concern. While headaches are common, these distinctively intense headaches are different and should not be ignored. They can be a warning sign of various underlying health issues, including potentially life-threatening conditions such as stroke, aneurysm, or bleeding within the brain. These headaches typically come on suddenly, reach their peak within seconds, and are incredibly painful. They may be accompanied by other symptoms like nausea, vomiting, or altered consciousness. If you or someone you know experiences such a headache, seek medical attention without delay, as early intervention is critical. Number 2. Frequent dizziness or loss of balance. Frequent dizziness or a recurring loss of balance is a concerning symptom that may signal an underlying health issue. While occasional dizziness can be harmless, persistent or recurrent unsteadiness on your feet should not be overlooked. These symptoms may be a precursor to a range of conditions, including inner ear problems, neurological disorders, or even an impending stroke. Dizziness can present as lightheadedness, vertigo, a spinning sensation, or a feeling of instability. Number 3. Visual disturbances. Visual disturbances encompass a range of unsettling symptoms affecting one's vision. These can manifest as blurred vision, double vision, or sudden alterations in the ability to see. These disruptions in normal visual function may indicate various underlying health issues, including ocular problems, migraines, or neurological conditions. Number 4. Unexplained fatigue. Unexplained fatigue, a persistent and overwhelming sense of tiredness, is a concerning symptom that can indicate underlying health issues. If you find yourself constantly tired despite adequate rest and nutrition, it may be a sign of medical conditions such as anemia, thyroid problems, sleep disorders, or even an impending stroke. This type of fatigue often lingers for days or weeks and can affect your daily life. It's crucial to seek medical evaluation if unexplained fatigue persists, as it can be a critical clue to an underlying health problem that requires timely diagnosis and management to prevent potential complications. Number 5. Cognitive changes. Cognitive changes encompass shifts in mental function that can involve memory lapses, difficulty concentrating, and changes in overall cognitive abilities. These changes may indicate various underlying health issues, including stress, sleep disturbances, neurological disorders, or even an impending stroke. Declines in mental sharpness, like trouble focusing or recalling information, can be distressing. Number 6. High blood pressure. High blood pressure, also known as hypertension, is a common but concerning health condition where the force of blood against the artery walls is consistently too high. This condition can lead to severe health complications such as heart disease, stroke, and kidney problems. Regular monitoring is essential, especially if you have risk factors such as a family history of hypertension, obesity, or an unhealthy lifestyle. Lifestyle changes, medication, and regular medical checkups are crucial in managing high blood pressure and reducing the risk of associated health issues. Number 7. Chest pain. Chest pain is a symptom that should never be taken lightly. It can be a sign of various health issues, including heart problems, lung conditions, gastrointestinal disorders, or even anxiety. While not all chest pain indicates a heart attack, it's a crucial warning sign that demands immediate attention. Cardiac-related chest pain may present as a squeezing, pressure, or heaviness in the chest, often radiating to the arm, jaw, or back. If you experience chest pain, particularly if it's severe, persistent, or accompanied by shortness of breath, nausea, or lightheadedness, seek emergency medical care. Timely evaluation can mean the difference between life and death in the case of a heart attack. Number 8. Facial numbness or weakness. Facial numbness or weakness, particularly on one side of the face, is a concerning symptom that may indicate various health issues. While it's a classic sign of a stroke, it can also manifest in milder forms as a precursor to a stroke. This symptom can affect the muscles of the face, making it difficult to smile, close one eye, or control facial expressions. Other possible causes include Bell's palsy, nerve damage, or infections. If you experience sudden facial numbness or weakness, especially if it's accompanied by other stroke symptoms like slurred speech or limb weakness, seek immediate medical attention, as early intervention is critical in stroke management and recovery. Number 9. Unexplained nausea or vomiting. Unexplained nausea or vomiting, when persistent and not related to food poisoning or an upset stomach, is a concerning symptom that may signal underlying health issues. It can be attributed to various factors, including infections, gastrointestinal problems, migraines, or even pregnancy. However, it's also important to recognize that unexplained and recurrent nausea or vomiting could be an early warning sign of severe medical conditions such as liver disease, kidney problems, or, in some cases, an impending stroke. If you experience unexplained and persistent nausea or vomiting, it's crucial to seek medical evaluation to identify the root cause and initiate appropriate treatment. Ignoring these symptoms can lead to complications and delay in diagnosis. Number 10. Trouble speaking or slurred speech. Trouble speaking or slurred speech is a hallmark symptom of a stroke, a medical emergency where blood flow to the brain is disrupted. It can also occur as a transient or intermittent issue before a full-blown stroke, known as a transient ischemic attack (TIA). Slurred speech involves difficulty articulating words, and it's often accompanied by confusion and trouble understanding language. This symptom should never be ignored, as it can indicate a severe neurological problem. Seeking immediate medical attention is crucial when speech difficulties occur, as early intervention is key to minimizing potential damage and improving outcomes in the event of a stroke or TIA. Number 11. Difficulty swallowing. Difficulty swallowing, medically known as dysphagia, is a distressing symptom that can be indicative of various underlying health issues. This condition can range from mild to severe and is often associated with discomfort or pain while swallowing. Dysphagia may be a sign of problems in the throat, esophagus, or even neurological disorders. It can also manifest as a precursor to a stroke, especially when it occurs suddenly or is accompanied by other stroke symptoms. If you experience persistent or recurring difficulty in swallowing, it's vital to seek medical evaluation to identify the root cause and implement the appropriate treatment, as addressing dysphagia early can prevent complications and improve overall well-being. Conclusion: recognizing the warning signs of a stroke 1 month before the event can be life-saving. If you or a loved one experience any of these symptoms, it's crucial to consult a medical professional promptly. Early intervention and appropriate medical care can help reduce the risk of a full-blown stroke and improve outcomes. Remember that stroke is a medical emergency, and every second counts in seeking medical assistance. Stay informed, stay vigilant, and prioritize your health to reduce the risk of stroke.